Hi there. You will have received a letter from school recently which is to do with the things that we are putting in place here at Palatine to look after the children and look after the staff in the middle of the pandemic that we are in at the moment. In order to keep your son or daughter safe at school, the following steps have been taken. We've got staggered arrival and departure times in paired classes for parent arrivals. Hand sanitizer is going to be used on arrival and departure. We've got staggered breaks and lunch times, again in those paired classes. Some classes will eat their lunch in class to allow additional distance between class groups that are using the dining hall. We've got an extra afternoon break to increase the time outside as appropriate. We will keep the windows open in classes. Uniform will not be compulsory from September. Children can wear their forest school clothing and their PE kit on the days that they have those lessons. We will be having increased cleaning at school. We'll be having gaps between resources that we share to allow additional cleaning between their use. We will use equipment once where possible. We will have increased hand washing facilities in classrooms, and we'll have steps to make sure that children can get to the sink, and we will also have soap dispensers at children's level as well. Toilets will be for specific classes. Any trips that we go on will have an additional risk assessment that we complete before we go. We've got our anti-bac mats, which are at the indoor arrival points of school. We've got a one-way system going around the school, around the main block of the school. We've got lots of signs up with health messages about hand washing, and if you sneeze to do it in a tissue and to catch it and bin it around the school. Each class has got a bin with a lid on it, which is double bagged for tissues to go in. We are not allowing any non-essential visitors into school at the moment. And we will be having no large-scale events, such as parents' evenings and assemblies. We've also employed a housekeeper whose job it is to clean the school throughout the day. And we will be additionally cleaning class resources more often. We will continue to teach the children about the importance of hand washing and to catch it, bin it and kill it. And as a school we will keep up to date with the government advice and we will publish it to parents as quickly as we can. And for more information you can see our COVID risk assessment, which is available on the school website. So what are the symptoms of coronavirus? Well, the main symptoms are a high temperature. This means that you feel hot to touch on your chest or on your back. You don't have to use a thermometer to check. It means a new continuous cough, which means coughing a lot for more than an hour or having 3 or more coughing episodes across 24 hours. If you usually have a cough, it might be worse than usual. It means a loss or change to your sense of taste or smell. This means that you might notice that you can't taste or smell anything, or that things smell or taste different to usual. Most people with coronavirus have at least one of these symptoms. If you do have these symptoms, you need to stay at home or self-isolate. Don't leave your home, don't have visitors to your home. Anyone you live with and anyone in your support bubble must also self-isolate. You need to get a test. Get a test to check if you have coronavirus as soon as possible. Anyone you live with and anyone in your support bubble should also get a test if they have symptoms. If your child has any of these symptoms, they must not come to school. If another member of your household has these symptoms, your child will need to self-isolate, along with all your other household members for 14 days. If your son or daughter has symptoms of coronavirus or has tested positive in the last 7 days, they must not come to school. This is essential. If your son or daughter has symptoms, you must book a test. All children and young people can be tested, including children under 5, but children aged 11 and under will need to be helped by their parents or carers if using a home testing kit. You must provide details of anyone they have been in close contact with if they were to test positive for coronavirus, or if they were asked by an NHS test and trace. They must self-isolate if they have been in close contact with someone who develops coronavirus symptoms or someone who tests positive for coronavirus. What must happen if someone in your household tests positive? If someone tests positive, they should follow the guidance for households with possible or confirmed coronavirus infection. And they must self-isolate for at least 7 days from the onset of their symptoms and then return to school only if they do not have the symptoms other than a cough or loss of sense of smell or taste. This is because a cough or a loss of smell or taste can last for several weeks once the infection has gone. The 7-day period starts from the day when they first become ill. If they still have a high temperature, they should keep self-isolating until their temperature returns to normal, and other members of their household should continue self-isolating for the full 14 days. If your son or daughter develops symptoms at school, they will be taken to the medical room and cared for by a member of staff. You will be telephoned and you will need to collect your child immediately. You need to be contactable at all times. The staff member will be required to wear PPE at this time, so please be aware of this and do not be startled on arrival. Your son or daughter will be sent home to self-isolate for at least 7 days from when the symptoms started, and you will be informed to book a test in accordance with the test and trace process. Tests can be booked online through the NHS Testing and Tracing for Coronavirus website or ordered by telephone by NHS 119 for those without access to the internet. You must do this. When will I be notified if there has been a case of coronavirus in school? You will be notified if there is a confirmed case in school, according to advice received from Public Health England and the government. Our procedure is the procedure laid out in Guidance for Full Opening. Palatine staff will take swift action when they become aware that someone who has attended has tested positive for coronavirus. Palatine staff will contact the local health protection team. This team will also contact schools directly if they become aware that someone who has tested positive for coronavirus attended the school, as identified by NHS Test and Trace. The health protection team will carry out rapid risk assessments to confirm who has been in close contact with the person during the period that they were infectious and ensure that they are asked to self-isolate. The health protection team will work with Palatine staff in this situation to guide them through the actions that they need to take. Palatine staff will carry out all actions required of them. Based on the advice from the health protection team, Palatine staff will send home people who have been in close contact with the person who has tested positive, advising them to self-isolate for 14 days since they were last in close contact with that person when they were infectious. Close contact means direct close contacts, such as face-to-face contact with a case for any length of time, within 1 metre, including being coughed on, a face-to-face conversation, or unprotected physical contact, such as skin-to-skin. Proximity contacts, extended close contact, within 1 to 2 metres, for more than 15 minutes with a case. Or travelling in a small vehicle like a car with an infected person. The health protection team will provide definitive advice on who must be sent home. To support them in doing this, we are recommended to keep a record of staff and pupils in each group and any close contact that takes place between children and staff in different groups. Palatine is doing this. A letter is being sent out from school on the advice of the health protection team to parents and staff if needed. Palatine staff will use this letter. In accordance with this guidance, Palatine staff will not share the names or details of people with coronavirus unless essential to protect others. Household members of those contacts who are sent home do not need to self-isolate themselves unless the child, young person or staff member who is self-isolating subsequently develops symptoms. If someone in a class or group that has been asked to self-isolate develops symptoms themselves within their 14-day isolation period, they should follow the stay-at-home guidance for households. They should get a test, and if the test delivers a negative result, they must remain in isolation for the remainder of the 14-day isolation period. This is because they could still develop coronavirus within the remaining days. If the test is positive, they should inform their setting immediately and must isolate for at least 7 days from the start of their symptoms. Their household should self-isolate for at least 14 days from when the symptomatic person first had symptoms, following the stay-at-home guidance for households. In accordance with government guidance, we will not request evidence of negative test results or other medical evidence before admitting children or welcoming them back after a period of self-isolation. Should my son or daughter wear a face mask to school? The current advice from the government is that wearing a face covering or a face mask in schools or other education settings is not recommended. Schools and other education or childcare settings should therefore not require staff, children and learners to wear face coverings. Changing habits, cleaning and hygiene are effective measures in controlling the spread of the virus. Face coverings, or any other form of medical mask, unless instructed to be used for specific clinical reasons, should not be worn in any circumstance by those who may not be able to handle them as directed, such as young children or those with special educational needs or disabilities, as it may inadvertently increase the risk of transmission. Any homemade, non-disposable face covering that children or staff, young people or other learners are wearing when they arrive at their setting must be removed by the wearer and put in a plastic bag that the wearer has brought with them in order to take it home. The wearer must then clean their hands. When staff, pupils or visitors arrive at school wearing face coverings, they should be removed of and disposed of in a covered bin, if there's enough space in the wheelie bin near the entrance. Or if the face coverings are reusable, they are placed in a sealed plastic bag to be taken home. After removing the face covering, individuals must wash their hands immediately. This process is communicated to all staff, pupils and parents. Where possible, according to current guidance, we can cover classes with staff from other classes. However, this is not always safe or possible. If too many staff are off in a class and it is unsafe to run, classes may have to close at short notice. Home learning will always be provided in these circumstances. And you will get a letter that you need to complete and return the reply slip to show that you have read and understood or heard and understood all the information in this letter. Thank you.